Ja, herzlich willkommen zu einer naiv or not so naiv Fragerunde. Die Fragen haben wir gesammelt im Laufe des Tages. Oh, sorry.
We can also make it in German, but I think we prefer English.
I'm so sorry. So I'd repeat that. Thank you very much for coming to this little Q&A. We had some boxes out in all the rooms, and we asked you to ask naive or not so naive questions. My name is Helen Fares. I'm a journalist, I'm a psychologist, and a human rights activist, and I do informational work and educational work, especially on Instagram and in documentaries on mental health and human rights violations. And I'm here with Patrick Wentorp and Moritz Spangmacher. And if you'd kindly introduce yourselves so we can start the questions.
Start? Okay. Yeah, it's a pleasure to be here with you. My name is Patrick Wentorp. I have a background in cognitive science. I work with the Mind Foundation for 4 years. I'm a psychedelic integration facilitator and work also in education and trainings for adult education and also in public health. So I work with the Finder Academy, which is a public health company focused on conducting prevention programs in schools with adolescents. So I also have the public health perspective on the topics and questions we discuss. And yeah, I look forward to discussing with you.
Thank you, Patrick. Moritz.
Yeah, happy to be here with you. I'm a physician. I work at the Central Institute of Mental Health in Mannheim, where we conduct the episode study, so where we give psilocybin to patients with treatment-resistant depression. And I also conduct a study with ketamine in the same indication. Yes, I'm part of the...
Just a second, we're gonna change the microphone.
Psychotherapist. So, psychedelic therapist in that study.
Thank you very much. Did you get it all? Was it audible? Okay, people in the last row are saying yes. That's perfect. So we have 1 hour now to ask both some of the questions that some of you have asked in the boxes, but then also we are going to be able to open the round for you guys to ask some questions. I'd like to start with a question, and you both can always choose who of you two feels more capable or more willing to answer the question. The first question comes back to the question of what is reality. So multiple people, when taking psilocybin, for example, say that their perception of what is going on and what they usually see is so different. So one of the questions was, how can psychedelics help individuals in knowing what is real?
Maybe I can start. As someone with a passion for philosophy, I really like that we also discuss these more broad and deep questions. So of course I cannot give like a complete answer, but maybe I try by saying that, of course, to our understanding, the best theories we have about how our brain is predicting reality, predictive processing, which is one of the theories that is out there and has been validated to quite some extent, says that we make predictions about the world all the time. So we're not processing all the information that is coming to us, but the brain makes prediction, and there's a certain prediction weight based on our experience. And what psychedelics seem to do is that they lower our beliefs that we already have. So there's more information coming in that would otherwise be explained away by the predictions we already have. And that's quite interesting, and there has been some studies about that also in therapy, but also for laypersons alike. I think that's interesting because basically our brain, our consciousness may be opening up to reality to quite some larger extent as usual. And this might be interesting to explore what reality is without finding definite answers. So I think it's also very important to not fall prey to beliefs that might arise in psychedelic experiences, but all the way throughout psychedelic experiences and also afterwards remain open for new information. Otherwise we may become rigid in our beliefs.
Can I ask a follow-up? So how is a person supposed to know what is reality and what is not reality when it comes to making an experience on psychedelics and then learning maybe contradictory information afterwards?
That's a very good question. I would say that very basic, but I would say that what is very important is to train this ability to reflect, to have this observer quality of our consciousness, where we basically just observe without judgment and don't be too quick in making a choice whether this is the reality we see or not. So, for example, a person that has had a belief that there's no God, that was an atheist, and on psychedelics makes the experience that I'm one with all and I am God. Maybe it should be, or maybe it's worthwhile to meditate and reflect on this new belief that is forming, I am God, which could be also a quite dangerous belief.
Yeah, I mean, I would only like to add, like from a clinical perspective, that the sense of reality, if it like gets disturbed by psychedelics, that can also be a very dangerous thing. Like we always need to be very careful with people who have psychosis, for example, who have lost their sense of reality, and where psychedelics can actually be harmful. So we don't include any patients with psychosis or people who have relatives with psychosis in our study, since the data for that is like really, small.
Adding on to that, what about, for example, people who already have a not so clear and real perspective of what is real? For example, people with body dysmorphia who look in the mirror and while they are a size that would be, for example, normal, and I mean scientifically normal, of course not normal in a social kind of way. When they look into the mirror and they see something so different than what is actually real, could psychedelics help with that?
I think it's a rather complicated question because like it can help to have your rigid system of beliefs questioned. For example, if you're like also a depressed person who's like convinced that life is not worth living or that their life is not worth living, can have very helpful changes of their perception and therefore like realize that there are other perspectives than their own. But then again, there are people who are like maybe very open in their sense of reality, and there it can be harmful to like maybe be overwhelmed by all these questions that a psychedelic experience can bring with it.
I just thought of something because I always have follow-up questions when a question is being asked. I would like to open the room because, as I just learned, we have 1 hour instead of 30 minutes. And if you feel like a question has been answered, but you have a follow-up question on that specific topic, you can raise your hand. If I don't see you, can shout, Helen. and then, okay, there's a follow-up question already. Perfect. Yeah. Probably not going to answer.
Hi, thank you. So it is kind of a follow-up, and let me know if it's not on topic, but in terms of antipsychotic medications that can also be used to target bipolarity, would bipolarity also be one of those conditions that you are very cautious about administering psychedelics because reality can shift so quickly? And how would you handle cases who are actively taking medication, like Seroquel, for example, hypothetically?
So I think you have to, that's a very interesting question. I think you have to differentiate between bipolar type 1 and bipolar type 2. So where you have real manic episodes or where you have this hypomanic episodes. There's actually been a study in bipolar 2 disorder, so where they only have hypomanic episodes, that showed helpful results or like promising results with psychedelics, with psilocybin. In our study, we exclude both of the bipolar disorders since, we see the risk is too high to induce a manic state. But it's a very interesting indication, because bipolar disorder has really not so much options that you can give to treat.
Great, thank you. Thank you for the question. So, there's another follow-up question. Can we have a fourth microphone by any chance? Yeah, let's try that one.
I guess my question is also related to this. So we're talking about reality, and in a psychedelic framework. And the last days we have talked about like research in psychedelics is focused a lot in therapy and how we could use them to improve our well-being and stuff. But I'm sure that there are a lot of other disciplines that could benefit from introducing psychedelics to them. And in this case with reality, I mean, we have the philosophy part of what is real, but also I guess the physics parts of what is reality. Do you know how we could dive into that, like how to apply psychedelics to other disciplines that are not health or philosophy?
Of course, we are here as a cognitive scientist and as a clinician, so we're not physicists. Yeah. So I cannot really say a lot about that. It would be interesting to see how physicists with more psychedelic experiences might be influenced by their psychedelic experiences, and how that would maybe change their worldview, their theories, and so on. But since I'm not a physicist, I think I cannot say a lot about that.
If you come to me later, I actually know a physicist who's here who has made experiences with that, so I can connect you to. Great. So the second question that we took away from the boxes is, do psychedelics show us more of us individually, or do they lie to us? Because quite frequently I have made the experience of someone coming to me and saying to me that they have PTBS or PTSD in English, and they felt so good while being on magic mushrooms, and they felt like this was a lie. How can I feel good again if I have this experience twice a year and I feel good for 4 hours combined, but then the rest of my life feels miserable? Is that a lie, or is that what the person actually is?
I can start and then you can continue. So I think from an integration perspective, it's very important, and this case makes it very important that the mindset and the understanding we have of psychedelic experiences also shapes the whole experience, right? So if a person has the belief that I'm taking a substance and then something is happening to me, which I don't fully understand, maybe it's an illusion, and afterwards I will be normal again, then of course this will influence how much I take away from it, how much I will learn from the experience. And it, to me, stresses the point that integration work is really what it all comes down to in the end, because that person might as well take away valuable insights from the experience that, for example, he or she is able to feel different from his usual state, that he can interact with the world better, that there's not this rigidity or sadness or this burden. And then it comes to, okay, how do I implement this in my everyday life? What practices would help me? What people would help me? And it becomes a whole process, right? But if this is not given, then I think these cases can also happen.
I think it's a very interesting question and goes back to what is reality, I guess. In psychotherapy, like in integration sessions, are always like, we also get constantly asked, like, I feel now again how I felt before. Was this all like just a trip or something? And we always try to engage the persons to see how much authentic expression can be in such a psychedelic state. I think many people actually find through truer self or to a core that they can't access to usually. And then sometimes it's just a leap of faith to say, okay, this where I felt better, where I could like feel better and could decide against my disease, that was a like real experience. I think that sometimes is a leap of faith, and that like has a lot of to do with integration. I totally agree.
What does integration work look like?
That's a very deep question.
Is it always therapy?
No, it doesn't have to be always therapy. Every person.
I disagree.
Okay, that's going to be interesting then. So what the Mind Foundation is offering, for example, are integration courses, integration workshops like Beyond Experience that I'm also facilitating, which is specifically not therapy. Of course, we use therapeutic methods, like for example, value work, so inviting people to reflect upon the values that are most important to them, that they want to really express in their everyday life. And this is a method that is also used in ACT, acceptance and commitment therapy, but every person can use these methods, right? So in a nutshell, I would answer the question, what is integration work? To learn from psychedelic experiences, to implement some of the insights you have gained, some of the experience you made into your everyday life, and see what you can take away from those experiences. Why is it therapy?
I mean, I actually agree with everything you said. So it maybe goes back to the question, what is psychotherapy? So, but for me, doing changes, also like all the things you mentioned, like doing more sports or stuff, that's also all part of psychotherapy. I think these cognitive things and also behavioral changes that we do, they are all part of psychotherapy, no matter how you call them. But that's actually what people also do in psychotherapy, that it's not psychedelic assisted.
Do we have any follow-up questions on this specific topic from the audience?
Hi, thank you. I don't want to go off topic, but to Patrick maybe. In that line of thought, who is entitled or eligible to do integration? Has to be a psychotherapist, psychologist, or it can be someone else. And if it's someone else, what kind of courses are adequate for that?
Viewing integration as not as therapy exclusively, pretty much every person is eligible for doing integration work, also to specifically the courses that Mind Foundation is offering, but also from a theoretical perspective, if we view integration as the process of learning, of becoming more whole, of finding out what we really value in life and of what we want to become in life, then I think these are questions, philosophical questions that every human being has to face and is invited to answer in his or her unique way. So there's no limits, in my opinion.
Yeah, I mean, I again have to be the one to be a bit more cautious, I guess. I think these psychedelic experiences can be very, very challenging, and therefore it's extremely important, in my opinion, to have someone who has experience with states of deep affectal, extreme affect states. So like, for example, the Imperial College, they described one case where there was this woman who we experienced some trauma and was left with this idea, was this real or not? So I think to guide an experience like this and to be there afterwards and to integrate this, you have to have competence to know how can you deal with such complex states. So I think that's why we definitely need a very good training and for people who do integration.
What does that training look like? Was also part of the question. What kind of training is it? What does it look like? Does it have to be a psychotherapist, or can it be some other kind of training?
I don't know. Do you want to answer that?
Maybe I can just clarify that I understood your question as who is eligible for doing integration work, in the sense that doing it for oneself. I of course agree that facilitating integration work in a more professional setting does require skills, facilitation skills, also skills in knowledge and psychology, how the human psyche is working, experience with potentially very difficult states, potentially with trauma, because many people have trauma, also if they come to self-exploratory workshop formats and not to therapy. So there is required a lot of caution. And yeah, just want to express that.
I feel a little bit, or maybe that's something that has been also and already brought up, but what about the criticism that is about, we talk about this on such an intellectual level and we put this academic stamp on it and we say that you have to be a therapist or you have to have a specific kind of training, where when we think about where this kind of treatment or medicine comes from is very often when we talk about South America, excuse me, and Central America, where people have used this medicine also in a very non-academic context.
That's a very complex question, and I think you could talk for long about this.
I think we have 45 minutes left.
But I think it's a very important point to see the roots of psychedelic therapy and to just be aware where it comes from, and not that it's not something where we colonize it. And so this is very important, and I think it's very important to pay the respect for everything we've learned from that. I think in the end it's all about context, and if you say you use a psychedelic as an antidepressant, as a medication in our Western society, then you have to ask who has to do this in our society, in our Western society. And then it would be very important to me that it's done by professionals, because if not, this can be a very dangerous, powerful substance that can be misused and that can also lead to harm, not only done by the substance itself, but because people don't respect boundaries, for example, that people have learned in psychotherapy. I think it's really important that it gets regulated in our Western society context, which doesn't mean that the place where it came from doesn't have value. It certainly does.
Do you want to add to that?
Maybe just adding before the follow-up question is coming. So I see your point, definitely, Moritz. At the same time, we had a very interesting talk yesterday from Dr. Sarah Betap about why some psychedelic therapists are better than others, and what really a good psychotherapy training would entail. And that's of course a very interesting and important question. Is it really the people that, for example, in Germany have the best grades in high school that can then study psychology, who would then also be the best therapists? Or is it maybe other people? And that's an important question that I think I don't have the answer to, but it's important to raise. Yeah.
Thank you. Yeah.
I would like to add, something to what you just mentioned in passing, that why does it have to be academics administering psychedelics in the Western world, as opposed to the so-called original or indigenous peoples where we know those psychedelics from. We have to be aware that also the administration of psychedelics in the original cultures are not being done by lay people, but by highly specialized professionals. And I would very much like to admonish against what I discovered of a very much bon sauvage type of notion that is quite widespread within the community. So I think we all have to take a step back when we talk about the original cultures that those psychedelics stem from, as long as we are not very, very well familiar with those cultures. Thank you.
Thank you so much for your answer. I would actually like to ask a question back to you, if you like. What does taking that step back look like for you?
Basically, to be very much aware of where my own cultural context is from, and to be aware at all times that I am a person of Western descent, which in my case is not the case, but for most of the people here. And that as such, I am socialized with a lot of unspoken underlying concepts and ideas that I take for granted and that I think everyone else has to have, which might lead to some very frustrating debates when you involve in discussions with people from other cultures.
Thank you. Want to add to that, Moritz?
I just want to agree. I totally agree with you on that point. That's why I say I can only speak on my own cultural context here, which is school medicine and which is like psychotherapeutic context.
Do we have any follow-up questions in this topic? Yeah, there's one in the last row. Sorry, can I get some more water, please?
So thank you. I'd like to do a follow-up question on the one that what is real and what is not in the experience that particular patient had. As a disclaimer, I haven't had any experience yet under a psychedelic substance. And I want to challenge a paradigm here that somehow seems to me clear, that patients are usually in a more or less sensory deprived situation under the influence of a substance, right? They get the music maybe and the therapeutic touch, the photos I saw, but they have the visual deprivation. So I come from a field of schema therapy where we work a lot with imagination and the power of IRT, for example, the reprocessing of trauma images. So we very much like the patients to get somewhere and give our input and steer the therapeutic process, as opposed to hypnosis where we would rather try to suggest something even. So why does the field not actively take influence during the session? Why only during integration?
I think that's a very good question, and the answer is we simply lack the data right now. I think a study where you would have more intervention during the psychedelic experience is definitely needed and should be done. I think talking about your background in schema therapy, I think that's very helpful for psychedelic therapy. And there's actually a very interesting paper by Chris Timmerman, who had a talk this morning, I think, who talks about how you can deal with these false memories if they come up in a psychedelic experience. Which level of value and truth you can give to that. I think it's a very good paper. Yeah.
Thank you. Any more questions on this topic? Okay. So one of the other questions was, and this is quite interesting, is it, as all the questions are, of course, is it possible that politics in general will become unbiased when it comes to psychedelics?
So the question is if politics can become unbiased.
Politics, politicians, yeah, it's basically.
Yeah. So how I understood the question was also like, is it possible that psychedelic research is completely politically unbiased? And there's also an interesting question, maybe there's various. I would say no, because as also Andrea Jungabel, who had a talk in the beginning of the conference said, at the moment, of course, always the funding, so what we can research, what we do research is where people have an interest in funding and spending time and energy in. And of course, this is always political, right? This is always shaped by certain dynamics and power structures. And this is not bad or something. It's just the way it is. It's just a given for me, and it's not a bad thing that it is political. Yeah, we have to be aware of that, I think.
So you shift the question. You say that the research is never going to be unbiased because it's being funded by, for example, politics or politically influenced groups.
From a very high standard, of course, the findings itself can tend to become as unbiased as it can be, but at the same time, from a philosophical standpoint, it's never going to be completely unbiased.
What about the other way around when we think about Nixon, for example, where politics had such a big impact on not being able to, or like criminalizing psychedelics? Do you think that politics have an interest in keeping psychedelics criminalized?
What is politics?
Politics who is leading right now is basically what I'm saying.
The government of a certain country, or well, I think that governments have an interest in public health, yeah? And I do think that, and that's what the whole conference is about, what Mann Foundation and other organizations are doing, is to show that there is benefits in psychedelic therapies and in using psychedelics, maybe not only for therapy, but also for human development and well-being. And I truly believe that politicians and governments have an interest in promoting human development and well-being if it is shown that there is such benefits. And it can be experienced in safe and legal settings.
A follow-up question to that would be if you both think that psychedelics, such as psilocybin, for example, can actually change a society.
I think that's a very interesting question, and I would like maybe mention the talk my boss Gerd Gründer, who's sitting here, had 2 years ago at this conference. Really recommend it. It's a great talk. It's still on YouTube, where you can
thank you.
where you can see that of course psychedelics can have an impact on how we live, and I'm also actually optimistic that it can have a beneficial impact on society. But it doesn't change the fact that we still have a lot of other problems, political problems, that we need to change if we want to change mental health and public health. You can't just treat individually people without changing society.
In which ways could it be beneficial?
I think a lot of points how this could work are certainly raised by Gerd Gründer a lot of times, by how do antidepressants that we use now maybe can have an effect of emotional blunting, and psychedelics can maybe have an effect of emotional openness and empathy towards others. So I think there's a lot of in this direction. There's also one interesting survey study where they've seen that people who take psilocybin can feel more connected to nature and to the preservation of nature. So it's not like a controlled trial, but it's still interesting, maybe how these substances can play a role, how we see also our environment, if they are administered more often.
Part of the myth of the criminalization was also that people would become very peaceful all of a sudden and not go to war anymore. How about that?
I actually had a talk yesterday with Matthew Johnson and Samuli and Mr. Garcia Romeo, and there I didn't know that. I think Garcia Romeo told us that there are these stories of mobs, so like criminals who go once a year to the Amazonas to have a group psychedelic experience, so they can become better criminals. So it's not like you can just take a psychedelic substance and not be aggressive anymore or go to war anymore. It's I think that would be too simplistic.
Maybe just to add on that, or to amplify what you said, I think it's always important and helpful to keep in mind that a metaphor for describing psychedelics as non-specific amplifiers is always useful, and these examples show there's also anecdotal evidence of Nazis using psychedelics to improve or enhance the in-group relationship building, and thereby also to some extent reducing worth in the out-group. So yeah, it really depends on the context and the setting, and of course the hope is that there is something like a Bewusstseinskultur, a culture of consciousness, which is also being discussed tomorrow in the last panel. So basically a society that values consciousness, conscious experiences, and that wants to support people in exploring their consciousness, and gaining more understanding of how our own minds, our own psyches work. And that's my hope, at least, that this is also something that will come out of this whole field.
So to conclude, it would be that this could actually make people more peaceful if the integration and the session would be in the right setting?
I'm not so sure. I think it's really, we can help people with that, and we can maybe, but I think to change society, you have to have other points where you start, and I think it would be politics, but maybe that's just my opinion.
Just an optimist perspective is also that it's a question of what we mean by society, right? So up to 10 years ago, it would have been impossible to have psychedelic therapies even for treatment-resistant depression, and this is already being done, and hundreds of patients already benefit from these therapies. So to some extent, it's already changing society, in my opinion.
Do we have any questions regarding society before we change to another topic? There's one in the back.
I would just like to draw a picture if more politics people would take psychedelics, how would that change society?
That's a good question.
That's to you. Because you said like politics is probably the best point to change society. How would society change if more politics would take, I don't know, once a year a professional psilocybin session in a safe setting?
It's a nice thought experiment. We don't have data yet.
Come on.
I mean, but it's basic, isn't it basically what you just said, that it depends on the set and the setting, which is, of course, something that we always talk about when we talk about psychedelics, right?
Yeah. I mean, we have to be very careful here, I think. Like, I can relate to this idea. Like, I think there's even like some movies that play with this idea, what would happen if world leaders would take MDMA or something. I think a recent example of somebody who said openly that he takes psychedelics is Elon Musk. I mean, I don't want to get too political here, but I don't think that's a good example for someone who's changing the world for the better right now. So, yeah. But personal opinion, just like, yeah.
There's a little bit of a misunderstanding right now. Do we have half an hour or 1 hour?
Half an hour.
And the online program is half an hour, and you... So what do we do?
Let's close within the last, in the next 5 minutes.
5 minutes? Okay, great. Maybe this is a question that you can answer a little bit faster, especially you. What do you do as a therapist in a dosing session? It's not so philosophical, right?
Yeah, this far easier. I do that a lot more. Yeah, so we actually try to be very mindful there. So it's we always like see it like as a kind of sacred space where nobody else can get in. So we try to be very mindful and actively there for the patient. So if anything happens, we're always like directly there. But the truth is that like many of these people don't really do a lot for 6 hours, since they have their psychedelic experience and they are in in the state where they just are in a total flow. So they don't need a lot from us. So it can be that we sometimes like read something or write something down. But it's always important to be there if the patient needs you. And a lot of the times he doesn't need you or she doesn't need you, but a lot of the times he actually wants to talk or wants to hold your hand or just needs some confirmation that everything's going to be okay. And I think that's a very therapeutic role again, which is, in my mind, something a psychotherapist should do.
Thank you. There's a question from the audience.
Yeah, or something to add, because I think the Moritz background is more the study background with like a single dose of psilocybin, while in the Ovid clinic, for example, we work with several doses of ketamine infusions, and this is quite different, or this can be quite different. Normally the therapist is quite passive as well, but as you get to know the patient better, you know where they avoid certain things, and sometimes they would like put off their eye shades, and it could be a very good intervention of the therapist to say, no, stay there, go there, or maybe even encourage just by taking off the earphones and say something to them. And this depends totally on the therapeutic process with the individual patient, and is quite different, I think. In general, the psychedelic therapist is quite passive, but I think if you have a therapeutic process with several sittings, you can also then deduct from like the first 2 sittings were like this, and then maybe you change something in the third setting, maybe the doses, but maybe also the intervention.
Yes, I totally agree, and I think a lot of goes back to your question, how much intervention should we do during a dosing session? I think there's not so much evidence yet there, but a lot of like also the psycholytic models from the 60s, they did a lot during the substance effects were still very present. So I think it's a very interesting question that there should be more studies about.
To close off our session, I would like to ask one last question. Maybe it's a question for you, I think. How long will it take for psilocybin to be available for public health? Just a short, easy question.
Yeah, I mean, like with all the other questions, we really don't know. But we hope that it might be something that can be at least approachable in the next 5 to 10 years. I mean, MDMA should get prohibited next year in the US. I think I just heard in a talk in the European Union, it's still going to take like 5 years at least. So we really don't know, but 5 to 10 years.
Great. Thank you so much, Moritz. Thank you so much, Patrick, for answering the questions. Thank you all for asking the questions. And yeah, I'm really happy to see you later in the party.
Everyone.